Esther Gifted Hands coming to you with my laser hair removal experience.
This is my first time coming here. I used to get laser treatment a long time ago, and I decided that I wanted to go back because I keep getting boils and ingrown hair from waxing or just shaving. So I've tried all types of products, and now I decided that I wanted to go back to getting lasered again because that would solve a lot of my issues, which I know from past experience. So here I am.
This is the view of the office. When the doctor comes in, I make sure to ask her every question that I need to know, especially the viewers that are watching this. When you have darker skin, it is kind of like harder to find someone that can do laser the right way. So that's why I wanted to make sure that she explained it to us.
You're interested in laser hair removal. I'm going to go through my whole spiel so you understand how laser works and skin types and all of that. The ideal candidate has light skin and dark hair because the laser sees pigment. So that patient with the light skin and the dark hair, that laser knows to put all of its energy towards that dark hair. So we don't really end up with burns or anything like that with the skin. When we have darker skin tones, so anything like it's a Fitzpatrick scale, 1 through 6. A Fitzpatrick 4 would be like skin, Latino skin. 5 would be a little bit darker. 6 would be like, I'm trying to think of a celebrity. Candace Owens. Just because you have dark skin doesn't necessarily mean you can't do laser hair removal. There's a certain laser you need in order to protect the skin. And that laser is called the 1064 YAG, which we have here. The whole concept with that is it's a longer wavelength. So it kind of spares the surface of the skin and penetrates deeper so we don't hurt the skin with the burns and the blistering. Because when you have dark skin and dark hair, the laser gets confused and says, I don't know what to go after. Do we go after the skin or do we go after the hair? And so that's where you can end up with blisters and pigmentation issues, and we don't want that. So anytime I have a darker skin individual, we always do a test spot in that area just to make sure the laser doesn't interact with the skin in a negative way. Now, it's a little area where we're going to treat. You, being the bikini, we'll do an area in the bikini. I have patients who are your skin tone and they want to do it on their face, and that's perfectly fine. But when I do hair removal on the face, I kind of do like a little test spot right here, just in case something should happen. We want it to be under the jawline instead of on your face. And that just allows me to know, okay, we can safely and effectively do the treatment without hurting the skin. So each time you come in, the full area is treated. Those hairs that respond, or the ones that are reduced, are the ones in the active growth cycle, technically called the anagen phase. Only a quarter of those hairs are in that cycle in each treatment. Hence the reason why 5 to 7 treatments typically gives you that optimal results. Optimal meaning anywhere between 80 to 90% hair reduction. We're women, we're hormonal, so things like puberty, pregnancy, menopause can cause some hair growth. There are certain hormonal conditions such as polycystic ovarian syndrome where it's largely a hormonal issue, and those patients will be lifelong hair removal patients because they're probably never going to get that 80 to 90% long term. They'll be my frequent flyers. However, even those people who are not hormonally challenged, once you get that 80 to 90%, I might see you once or twice a year for a little touch up, a little maintenance. Not like you're coming back saying, oh my God, Jayme, I feel like I'm starting from scratch. It's more, oh, summer's coming, I'd rather not have to shave as much, you know? So which brings another point. So remember I said that ideal candidate has light skin and dark hair. So that laser focuses all of its energy towards that hair. Now when it comes to darker skin, you may need a little bit more than the 5 to 7 treatments because in order to do it safely and effectively, I don't want to bump that laser up until we burn up. You're like, oh, the hair hasn't come back, but now I'm burned. So we have to do it safely like that. And that's not to say you could do it in 5 to 7 treatments, but Realistically, it can take a little bit longer, but I've had patients do it in 5 to 7 treatments, your skin tone as well.
Okay.
Sun exposure, you want to make sure you're not going out in the sun 2 weeks before and 2 weeks after, meaning we're trying to get a tan, not we're, you know, when it comes to the face, I worry about that more, but wearing a baseball hat is perfect if you're going to be outdoors long term. But being that it's winter, this is the best time to do it because we're not worried about sun. That is good. Immediately after the treatment, you will have little, they almost look like little pimples, but it's not. It's called perifollicular edema. It's basically swelling of the hair follicle. That is a great response. I like to see that because that lets me know we've delivered a good amount of energy to that hair follicle to produce a response. And that is what I'm looking for. It can last anywhere from a half an hour up to 72 hours, but I mostly see the 72-hour one with like dudes in really bad back hair, like they course everywhere. You space your treatments every 6 to 8 weeks because that ensures us a whole new active growth cycle. Prior to treatment, I like my patients to shave either the night before or the day of, and I'll tell you why. Unlike waxing, where you want to see a little bit at the surface, so you can grab onto the hair and pull it, if the laser sees anything at the surface, the laser thinks, oh, here's my target, so we're basically charring hair at the surface.
So, they didn't tell me to shave?
It's okay. It's okay, honey. We're just going to tell. It's okay.
Okay.
The whole philosophy behind the shaving is when you shave, you have a nice clean surface. The laser goes there and says, I don't see anything. I got to go down to that follicle. And it forces it to find that follicle. So it works
better when you shave.
Correct.
Yeah.
Correct. During the treatment, you can shave as much as you want. Just no waxing, tweezing, nail, or bleaching. Because with all of those methods, mostly with the waxing and the tweezing, you're literally pulling the hair out of the follicle, so nothing's regenerated yet in that bulb, basically. So that's why anybody who's ever waxed, I say, wait 3 weeks, and then you can start your treatment. Just so we have enough, follicles to go after. Does that make sense?
Yeah. So, how long does it take for the hair to start falling out?
Okay, good question. In about 5 to 14 days after the treatment, you will have some hair growth. When you're taking a shower, you might notice, ooh, some of these hairs are falling to the ground. Those were those hairs in that active growth cycle. So you'll be left with little patches that still remain. So again, Esther, you can shave as much as you want because it will look a little funny. You'll have bald spots, everywhere because we don't know what hairs are in that active growth cycle. So again, that's why I'm like, shave as much as you want. But then I will say, I think people are most wowed after the first treatment. Sometimes after the second, because you go from having all the hair there to, wow, a lot of it kind of fell out. You know what I mean? But you'll start noticing between every treatment less and less. Yeah? Any questions? No? Okay. You ready for a test spot?
Yes.
Okay.
So today all we did was a test trial to see if the laser, if I will react badly to it, which I know that I probably wouldn't since this is not my first go around. I do have an appointment for the following week just to get the whole thing done. So today was just like a consultation just to see how it would go in the future.
I am back a week later to get the whole thing done. I forgot to shave, you guys. So she was kindly enough to shave for me, and here it is. She started with my stomach and then she went down. So I'm showing you what it looks like from the stomach area. And it feels like a small sting, but it is bearable, so you are able to sit through it without having to scream, yell, move around.
Ooh. Do you recommend any products for
The
Skin
hyperpigmentation
yes.
from the ingrown hairs. So the beauty with the laser hair removal is it kind of takes care of the root of the problem, and that's why we get the ingrowns, because of the hair down in that follicle. So because we're kind of destroying it in that way, it will ultimately help with the darker pigmentation. It may take several months, but the pigment should lighten. There are creams like hydroquinone and things like that are skin lighteners that can help to accelerate that process. But also you have to think about, the bikini area is kind of sensitive.
Right.
So putting like hydroquinone and retin-A in that
Might be
area
too
might make it
yeah,
too much. And,
yeah.
and a lot of times with your skin tone, sometimes it is too much for your body, and then your body produces pigment. Like when you get a pimple and you pick it and you end up with a dark mark underneath. That's exactly right. So because we're getting to the root of the problem with that laser, eradicating that hair follicle, in the long term, the pigment will improve because it's not going to be there anymore.
Okay, good.
Yeah.
Those products you mentioned, can I get it off of like Amazon, at Walmart? Where do I get
girl, I would recommend going to like a medical grade type of facility, so like a plastic surgeon or
to
a
get it
medical
prescribed.
spot. You got it. Because the active ingredients you're going to find are higher in a medical grade product versus, there are hydroquinones you can get over the counter, but a lot of them are like a 2%, 1%. A medical grade is like 4% and up.
Treatment 1 down. Stay tuned for the result of this treatment and the others to come.
Hi everyone, this is a 6-week update on my laser hair treatment. I got it done on the 9th of last month. Today is the 21st of this month, so it's exactly 6 weeks. And let me tell you, I am absolutely in love. That's why when you say you pay for what you get, and you honestly do. I was trying to go the cheap route when it came to laser hair removal, and I try to go to some lady that had it at her house. Worst mistake. I lost $300 going to her twice. I told her the first time it didn't work, and she still like convinced me to come back, so I did, and nothing. Like, you definitely can tell a difference from a professional and to somebody that's just a starter. When you have melanin in your skin, you just have to just pay the extra. And I say that I don't have to deal with ingrown hair. I don't have to deal with boils or any like prickly hair. Every time the hair grew, it fell off. Like, all the hair that grew out literally fell off. So I would say that now, like, my skin for my 6-week second treatment, I didn't have to shave because all the hair fell off. So I just can't wait to see like the process going on forward. I know now it's starting to feel so soft. I don't have those blackheads or, hyperpigmentation. And I really feel like that was all coming from like the hard wax, and that's shocking to my skin. So now I don't have to deal with that. Now I can actually like work on clearing my skin, getting rid of all those dark spots from when I had the hyperpigmentation. So that is what I'm working on. Little things that I'm buying. So I had acne in my face, so I'm using the same cream for my dark spots down here. Turmeric soap. I'm also exfoliating using the little glove. I can show you what the glove look like. Hold on. So I use something like this in the shower, and like I will absolutely say after like maybe a week or two using this glove, it literally scrubbed the hair off like bloop bloop bloop. So I actually love seeing that. Even when you like touch the hair, it would just like come out without no force. So that is one good thing. I will say, like, by the time I'm done with my 6 to 8 treatments, I'm pretty sure my skin is gonna feel like baby soft, because it's starting to feel like that off of just one treatment. So I'm highly pleased. I will recommend getting laser treatment if you are having the same issues as I. It's definitely worth the money. I mean, come on now, like, when you're talking about permanent hair loss, like permanent no growth, I mean, it's worth it. I just wanted to update you on the 6 weeks. I'm headed to there right now. I'm actually running late. So I will talk to you guys later. If I forget anything, I will talk about it in the car. So I will see you. Bye. Oh yeah, I got my braces taken off. I think last time I recorded, I had braces on. Yeah. So that is something new. All right, so I will see you later.
Here I am back for my second full treatment. This is the laser machine, and I'm excited.
So my second time around, it did not hurt at all. So yes, I didn't need, of course you don't need numbing cream, but the first time, because it's like a new feeling, it kind of like, so the second time around, you know, I didn't flinch. It was like really, really easy.
Here is a picture of a before and after of just 2 treatments. Let me tell you something. I am highly satisfied. You can tell a great difference with how my skin looks. If you like this video, please like and subscribe, and I will come back with a year update. Thank you for watching. Bye.